Hello, everyone. My name is Richard. I am co-founder of GoBrunch, and I would like to welcome everyone to Safety Dialogue 001. First of all, let me know if you can hear me. Type in the chat box, say yes if you can hear me. Okay, that's great. Great, everyone. So I really appreciate your messages. Welcome to Safety Dialogue 001. Again, my name is Richard. I am the moderator of this event and also co-founder of GoBrunch. Today, we're gonna have two special speakers in this really important event. And the first one is Fashusi Olainka. And let me know, Fashusi, if you're ready. And we just get started with you, and I just introduce you properly. Great. So before I turn on Fashusi presentation, let me just give you a few instructions. One of them is how to increase the window of the presentation. If you are on a desktop, you just need to click on the right edge and increase. You can do the same on your mobile device or use your gestures. All right. Let me just close my presentation. Okay, let me introduce you the first speaker of our event or conference. Fashusi is a staff of Marana Global Services, where he works as occupational health and safety instructor. He's also an instructor at the Institute of Safety Professionals of Nigeria and a senior executive advisor at Telco Euro Nigeria. He has gained experience in safety management while working with several organizations, and he's currently developing a project to support safety in schools across Nigeria. Fashusi is a professional member of the Institute of Safety Professionals of Nigeria and International System Safety Society, among others. He is the brain behind Safety Dialogue. And while Fashusi set his camera and everything in his presentation, let me just talk a little bit about Safety Dialogue. Safety Dialogue is a platform to create professional engagement with global industries. The idea is to provide a unique opportunity for brainstorming, discussion, problem solving, and collaboration to improve health and safety at work. Everyone, this first edition is focused on school safety management, taking advantage of the lessons we have learned from COVID-19, and we plan to reopen our schools. Together, we are involved. All right, first, Fashusi, we can see you. Let me just close here. Thank you very much for inviting me for the moderator today for this important event.
Thank you, Richard.
You're welcome.
Yes, thank you for this time we are spending together. It's really going to be a very rewarding time for all of us. So may I just confirm if everyone can hear me as well? I just know that Richard can hear me. Please, can you just confirm if you can hear me? You can just type in the chat area, and I know you hear me. Okay, so great. So yeah, now I'm sure that people can hear me. So once again, my name is Olayinka Fashusi. Thank you, Richard. You really did a good job pronouncing my name. I know you must have done a bit of rehearsal on this, but yeah, you did a good job. Thank you for this. So here, my name is Sola Yinka Fashusi. I work with Marana Global Services Limited, a member of Institute of Safety Professionals of Nigeria, and as Richard rightly said, and I'll be talking to us on one of our topics for today. This is safety dialogue. Um, we heard from Richard. He gave us an introduction, and that is just what we do. This is going to be an exciting platform for you and I, and for all of us to build together a stronger and a better workplace and a better society. And that is the essence of our meeting today. This is the first edition, and I'm really grateful for everyone who is making it here with us in this edition. So today, our topic, the first topic we'll be talking about is managing the new school challenges. Managing the new school challenges. So while I talk about this, I'd like to hear from us. What do you think? So it's time to share your opinions. Let us hear what you think about.
All right, everyone. Pashus is
I'll
just
be more
reconnecting.
stable online.
Please type in the chat what do you think about these challenges. I can hear you again.
Yeah, yeah. So I'll be taking up my video so that I can maximize my stay here with us. So I'll be using only the audio. I have a few questions for us, three of them. They are just to ask us what we think about the current situations, to just share our own perspective. The first one is this: is it safe for schools to reopen in your country? Is it safe for you for schools to reopen in your country? It's just yes or no. We want to know what the situation is in your country. So just type yes and put your country there, and we can all learn what is happening in your locality. Right. So is it safe for schools to reopen in your country? No. Okay. In India, not safe in India. Um, yes, in Qatar. Okay. Okay. No, in Nigeria. Okay. Yes, in Nigeria. Yes, in Nigeria. Great. Okay. Yes, in Nigeria. Wow. Interesting. In Libya, no. Okay. In UAE, yes. Okay. Yes, in Nigeria. Nigeria. Ooh, seems Nigeria is quite ready. Interesting. Interesting. Wow. Yeah, I love this. Okay, so why you sending your response to that? I'm going to move to the next question for us. Let's share our view on this as well. Are the schools prepared to reopen? Yes or no? You can just put your country as well. Do you think the schools are prepared to open? Yes. Okay. Nigeria. Thank you for Lami. Okay. In UAE, yes. Okay. In Brazil, no. Okay. No. In Nigeria. Oh, great. So um, we also have a mix of ideas here. A lot of people in Nigeria, yes, yes, okay, okay, great. Okay, so while we respond to that, I also quickly move to the third one, and that is this. Globally, do you think COVID-19 has created new challenges in schools? Globally, do you think COVID-19 has created new challenges in schools? What do you think about this? Globally, do you think COVID-19 has created new challenges? Okay. Elvis said no. In Nigeria, it hasn't created any challenges. Yes. Fortune said it has created challenges. Okay. In UAE, yes. Okay. Yes, in Nigeria. Okay. Abdallah Jibril, no. Yes, in Nigeria. Yeah. So generally we have a lot of yeses for number three as well. A lot of people believe COVID-19 has created new challenges in Nigeria and in other parts of the world. So with a few exceptions, we have Abdallah Jibril. I think you're from Libya, right? So in Libya, I guess no challenge. Yeah. So yeah. So this is just a general overview of what the situation is, and this is a clear demonstration of what the COVID-19 has created itself. Even among the professionals, among the healthcare practitioners, there is a divided opinion regarding the issues of COVID-19. The way we see it vary, the way we see it differs from person to person, from place to place, and that's a reflection of how we're managing it together worldwide. So I'm also going to be sharing my own opinion, of course, what I'll call an expert opinion with us on this subject matter today, talking about managing the new challenges. Good enough, I'm in safe place because many of us believe that COVID-19 has created challenges in our schools. So which means we have something to talk about today. And I'll quickly move on to my presentation. So what's that? What time is it? It's 3 o'clock. Yeah, sure, it's 3 o'clock. And this is time for us to talk about the new challenges that COVID-19 has created and how we can address this together and look at how prepared we are to reopen our schools. Right. So this is the best time to talk about this. And we have something from the Honorable Minister of Education in Nigeria. That is Malam Adamu Adamu. He said something, and I quote: "Now is the time to plan and address the eventual safe reopening of schools and learning facilities. Now is the time to plan and address the eventual safe reopening of schools and learning facilities." This statement must have been motivated by the fact that he also agrees that COVID-19 has created challenges for us in our schools. And that is, of course, what we all have confirmed in this particular response we have given. So, why are we talking about this topic today? Managing the new school challenges. Why are we talking about it today? A lot of information is out there, but with limited proven knowledge about COVID-19. You can agree with me that presently there are a lot of information there from both the experts and the non-experts, right? So everybody is just sharing their opinion, and you'll be amazed. You'll be amazed to also know how divided the professionals are on the subject of COVID-19. Recently, there was a headline from the BBC. It was in their news, trying to suggest why the why the mortality rate of COVID-19 is low compared to other modern Western countries, right? So a lot of ideas are coming, and some people are trying to attribute this particular low mortality rate to poverty in Africa. So that's kind of suggesting that maybe people are not dying in Africa because Africa is poor, because Africa is congested, because Africa has poor power supply, because Africa has we don't have access to clean water, what have you. So whatever you want to use to describe poverty, some experts are saying maybe this could explain why people are not dying in Africa. But really, as an expert, does it really make sense? Looking at the trend of COVID-19, looking at the projections of COVID-19, looking at the expert opinions from the WHO and the CDC especially, we understand the guidelines they've given to us before now, that COVID-19 will spread more where you have crowded places, and that is the idea behind social or physical distancing. So does it now make sense for some people, some scientists, some experts to be saying, okay, maybe people are not dying because we are congested in Africa, when they are saying we should maintain physical distancing? So this is an idea of what information we have out there. This is an idea of how unproven some of these evidences, some of these facts are. These are a confirmation of how divided the global community is when it comes to issue of COVID-19 and understanding this topic properly. And of course, I must also confirm, I am not a medical professional. Um, our evidences, our information are also based on some of these authorities, and authorities like the Center for Disease Control, WHO, that's World Health Organization, the Nigerian Center for Disease Control, and other government agencies providing um, information on COVID-19. Because we don't have, when I say we, myself, Safety Dialogue, the company I work with, Marana Global Services Limited, we don't have testing facilities, we don't run testing facilities, and we don't collect COVID-19 samples. So we strictly rely on what the authorities are providing for us. And that's the basis of our discussion today. And that is the basis for us to be taking some of the decisions we'll be taking together today. But even among these authorities we're talking about, there are a lot of divisions. There are a lot of personalized ideas on COVID-19. So it's still a game of chance. That is it. That's the fact I can confirm for us. It's still a game of chance. Game of chance in the sense that we have seen a downward trend in COVID-19 cases now. I mean, a lot of cases, a lot of countries are recording a very low prevalence rates. A lot of people are recovering quite very fast and stuff like that. So, on the general look, globally, COVID-19 is on a downward trend. The situation could vary from country to country, but if care is not taken, if we don't approach this properly, if we don't apply the precautionary principle, we might see a spike in this downward trend. We might see the cases start increasing again at some point. And why am I saying this? Because in reality, I would say we still don't understand the trend of this COVID-19. If you look at how it has been, people have been trying to say, okay, this is why we're having more cases, this is why we're having less cases. But these are barely what people don't understand. These are people just talking based on assumptions and new experiences they are gaining by the day. And so these experiences may not be enough for us to actually decide, okay, COVID-19 is going, COVID-19 has gone, or COVID-19 will come back. It's still a game of chance. One of the things that we need to look at is to understand how COVID-19 spreads. Right, so that's why I call this understanding the spread, because this is also very important for us at this point to know how to protect ourselves, to know how to protect our loved ones, and to know how to take decisions for preventing and controlling this in our communities. Uh, Generally, there are about three types of infections or method of infections or means of infections. The first one is the sporadic case. The second one is the clusters, and the third one rather is the community transmission. So we have the sporadic, we have the clusters, and the community transmission. Generally, what we mean by sporadic, this is where you just have maybe one or two cases of COVID-19 in a place, and you can easily say, oh, this person just came back from a particular country and is being infected. So now it's in this community, and we have a case. That's kind of a sporadic infection or transmission. Then when you have a cluster, it's like having a group of people, and then this group of people have been exposed to COVID-19, right? So you definitely say, oh, these people already have COVID-19, and it could be by a region, it could be by over a particular time, it could be by because of their location, as the case may be. But you can really define this group and say, oh, and that is what we had when COVID-19 started in Wuhan. There, it didn't spread to other countries. It didn't spread to other parts of China immediately. And what we're hearing in the news was, okay, Wuhan, Wuhan, Wuhan. That was a cluster as at that point. And the third one is community transmission. In this case, you have a large group of people who are infected with COVID-19, but truly or really you cannot trace their infection to a particular source. And that is a typical example is when you just have someone talking and say, like, okay, I've been maintaining physical distancing, I've been wearing my mask, I've been following all the precautionary measures stated by the government, yet I still have COVID-19. I really can't understand where it came from. Um, Last month, I was reading someone's comment on LinkedIn, And the guy was sharing, he said for some weeks he has been at home. He didn't go out to work, he didn't go anywhere, but suddenly he developed symptoms of COVID-19 and he didn't know where he got it from. And these are cases of community transmission. People start developing symptoms, people start getting infected, but truly you can't say this is where the infection is coming from. And this is the case in many parts of the world, including Nigeria and Africa. Many of the infections we have in Africa, in Nigeria, are cases of community transmission. If you have a cluster case, if it is not properly managed, it will degenerate to community transmission. So let us take a look at COVID-19 on a global scale. What is the situation globally? As at September 4, 2020, there are about 26 million people who are infected with COVID-19. So on a global total, over 26 million people were recorded to have been infected with COVID-19. In the last 24 hours, as at the time this presentation was being prepared, that was early this morning, more than 285,000 people also got new infections. So, of course, the case is reducing. There is a downward trend, but the number is still quite significant for us. Right. So, on a global scale, more than 865,000 have also lost their lives to COVID-19. Our condolences to their families, and then they are really the true heroes we have in this period. The medical professionals, they've done a lot to make sure that this trend is broken. So we still have more than 6,000 people who have died in the last 24 hours due to COVID-19. If you go to the website of WHO, you can see the complete data there. Here is just a screenshot of a particular section of that website. And here we can see Nigeria. Nigeria presently, as at 4th of September, has 54,588 cases of COVID-19. And then within the last 24 hours, we have 125 new cases, and total of 1,048 people have died. And then in the last 24 hours, we have 24 new deaths. This trend has continued globally. It varies from places to places. For instance, we can have Portugal here. Portugal has new cases of 418 within the last 24 hours, and then they had 2 death cases within the last 24 hours. So you can see there's no particular trend to define this is how it is here or this is how it is here. And that is why countries, that is why organizations, that's why societies have adopted a localized approach to manage the impact of COVID-19, because you may not really have a generic method of handling it. So what does it look like in Africa? We can also see here, this is the map of Africa. The pointed area is where we have Nigeria. Presently, as at 4th of September, 47 countries are still affected by COVID-19. That's a total of over 1 million cases and 220, that's 22,000 deaths in Africa. Of course, this is quite a significant number. And if we want to look at the projections of the world power regarding Africa, we'll say really Africa, we've done well in managing COVID-19. Though we had a lot of shortcomings regarding number of testing centers and testing facilities, and number of whatever you have test populations, right? So these are part of our shortcomings for decisions and our data. But for what we have on record, it's really commendable for Africa, right? So to also confirm how unpredictable COVID-19 is, even the authorities, even the experts, even the scientists could not explain why Nigeria, why Africa at large are having this low death cases, mortality, and the number of infections we have. It's quite unpredictable. And COVID-19 itself has really taught us that we have a lot of limitations in our knowledge globally. So what do we have in Nigeria? Here is what the cases look like in Nigeria. We have 36 states in Nigeria and the Federal Capital Territory, and that's what here, Lagos State, Nigeria, that was where we have the most of the cases reported. The next to it is the Federal Capital Territory, and of course, the reason for this is quite obvious for many of us who are in Nigeria. Lagos is highly dense, highly populated area. It's a highly commercial environment, and then we have that reflecting in the number of cases confirmed. And for those experts on BBC who are also postulating maybe overcrowding, maybe poverty has led to the number of cases, low number of cases we have in Africa. I also want to prove them wrong, because here in Nigeria, we have more people in Lagos, highly congested, and the living standard in Lagos is also on the average compared to what we have in Africa and the likes. So, as a true reflection of what some experts say, that when you have a place that is congested and don't have enough facilities, you may have more cases of infection. That's actually true for the case of Lagos. Similar for Abuja, that's Federal Capital Territory, right? So we really don't understand the ideas behind what those guys on BBC were trying to talk about when they say COVID-19 prevalence in Africa could be due to poverty rates. With time, we understand them better, actually. So we can see from Lagos down to all the states in Nigeria how the cases are being recorded from the highest to the lowest. And that's how it looks like in Nigeria. And our mode of transmission is community transmission. So this is on a date by date case. This date is the last date here is on the 4th of September 2020. We didn't have the record for today yet before this presentation, but as at yesterday, being 4th of September 2020, this is what our record looks like. And why is this important for us? This will now show us the trend of infection. This will now show us the curve over this period of COVID-19 prevalence in Nigeria. We can see where it started on 27th of February. We had only one case then, and with time, due to community infections, community transmission, the curve started going up, and then it was not really predictable. Goes up, goes down. On daily basis, you can have as much as over 700, 800, 900 cases. On some cases, even the following day, you have a sharp drop. So we really don't understand fully how this transmission is going. But of significant interest to us is the last few days, beginning from, say, around 19th of August to 4th of September. We can see there is quite a stable, what I'll call is a stable trend. The spike is not as significant as what we have in the in the previous days. And then in the last 3 days, we can see quite a predictable trend. And we also hope that this trend will continue downward. By the time today's record will be out, it may also shock us that we may have a spike. We may have an increase instead of the record coming down. So it's quite unpredictable, right? But this is what it looks like in Nigeria, and every country also have their records, their data, their graph in similar fashion. But on the average, we can say COVID-19 is on a downward trend. On the average, it's on a downward trend. A few of these spikes we have, a few of them are just on a particular day. Maybe the factors responsible for those days we don't understand yet. But of course, we see it's not a common trend again for us to have high cases being recorded. So what does this look like? Like I said, we have a downward trend, but we should apply the precautionary measure. A precautionary measure in the sense that we should not relax on whatever we have been doing now, before now. Instead, we need to do more to make sure that we totally curb and contain this spread, right? So countries, organizations, schools, and every individual, families should not relax. Because if we relax, then we become we come at risk again. The moment we start dropping the measures we have on ground, infections may increase, and that will not be a good one for us on our economy as well. So we have, like I said, 156 new cases and 3 deaths in the last 24 hours. Now that we're talking about reopening our schools, it is also important to look at what this could mean on our COVID-19 cases. But for us, and for me especially, I believe there is a chance that this downward trend may be reversed the moment schools fully reopen. And we'll see the reasons why I said this in the following slides. So let's look at the impact of COVID-19. Of course, across organizations, across individuals, across families, across borders, across regions, countries, continents, the impacts have varied. It has varied. In the United States of America, of course, we've seen a lot of devastation on their economy and on the number of cases of mortality cases they had. It's something that we really didn't expect everywhere in the world, that US will be infected or affected to that extent. But like I said, many times you can't predict what COVID-19 really is. We're just working with information that we have. So here is a picture of some students during the WAEC examination. WAEC is West African Examination Council. It's an examination for senior secondary school students. So when I was preparing this slide and I came across this picture and something came to my mind. In Nigeria, many of our schools really don't have enough facilities. We don't have conducive learning environments. In Africa, the story is still the same. And in many parts of the world, situations are quite not as easy as what we want it to be before COVID-19. Now, when you add COVID-19 to that, it's more of making a difficult situation to become more difficult. And that's what we can see for these students writing an exam. Let's just imagine you're preparing for this exam and you're writing maybe mathematics under this condition. You've been at home for months, you couldn't go to school. And when they say, okay, come and write your exam, they brought you to an environment like this. I don't know how many people will pass mathematics under this condition, considering the impact of COVID-19. And we should expect, by the time their results will be coming out, we may not be surprised the level of failure rate that WAEC will release, especially on this critical subject: mathematics, English language, physics, chemistry, accounting, and some of these core subjects. Right. So I don't know how many of us seated in this webinar today can confidently pass mathematics in this situation, given the factor of COVID-19. So generally, we have two sides of the coins from COVID-19. We have the good side and we have the bad side. The good side, many organizations now have well-defined processes and systems for better and more sustainable businesses. Why did I say this? Before COVID-19, people have been doing businesses and they've been making money, and many of them really don't have or didn't have a business sustainability plan. They don't have a business continuity plan. And that was why a lot of organizations shut down at the onset of COVID-19, because they didn't have something to keep them going. They didn't have alternatives to their businesses. But thanks to COVID-19, for companies that have survived, for companies that have been able to go through it, obviously they have redefined their businesses, they have redefined their systems, and they have processes in place now that will keep them going even in the face of another pandemic. We don't hope that should happen. But if any other pandemic should happen, a lot of businesses that have survived COVID-19 now will most likely survive it, because they are now better built, they are now more resilient, and they now have systems. And many organizations now have business continuity plan, which is very critical to success of any business. especially in difficult times like this. On the bad side, COVID-19 has led to loss of lives, quite unfortunate. Even in Nigeria, in Africa, every part of the world, people have lost their lives. People have lost their means of livelihood. Of course, there are people who were not actually employed, right? They were in one business or the other. They were depending on a particular source for their livelihood. But COVID-19 has actually cut that off, and it's quite unfortunate. Increased unemployment during the COVID-19, a lot of people lost their job, and the trend still continues as organizations redefine their businesses, as organizations restructure. A lot of people will still lose their job. That's quite unfortunate, right? Especially teachers. We have teachers who have been home for months without any means of employment, without any means of earning, and this is not a good one from COVID-19. Weaker economy, we've seen the impact on the energy sector, especially if the economy is being powered by fossil fuels, powered by crude oil, just like Nigeria. We can see the impact on Nigerian economy. It's not a good one. It has made the economy to become more vulnerable, and we hope we don't go into recession, right? So that's some of the impact. Increased hardship. Of course, like I said, if you live in Africa, if you live in Nigeria, sometimes you may see the other side of life, which is not quite enjoyable, right? So that's the situation. Even at that, COVID-19 has added to that, which is not making it very comfortable, very easy for people in that region. So reopening of schools, there have been some official statement from the Ministry of Education. Um, we have 104 unity schools in Nigeria, and of course, the government said the schools can now reopen, starting with the students in exit classes, maybe the junior secondary school level 3, senior secondary school, SS3, SS2, and the likes. So that is what we have from the Federal Ministry of Education. Then the public and private schools are also clamoring that they want to resume, and they seem so prepared to do so. But we'll see how prepared we are to go back to school. And many schools globally are also getting back, of course. We've had schools in China, schools in Denmark, schools in Israel, and what have you. A lot of schools are actually trying to get back now, especially because we have now this idea that we cannot lock down everything forever. So we're trying to see how we can get back gradually. Why that is good, it's also important that we do that safely, and we'll do it with a well-planned process. The question I want to ask us now is, are we ready? Are we ready to reopen our schools? Especially focusing on Nigeria. Is Nigeria ready to reopen schools? Many of us said we are ready. I want to agree with us for our reasons, yeah, but I also have my opinions on whether we are ready or not. So in Nigeria, most public and private schools have not made any significant changes in their systems ahead of the reopening. Yeah, while many organizations say they want to go back to work, while many schools, while learning centers say they want to go back to work, it's also important to look at how prepared they are in going back. It's also important to know what they have in place, what they have on ground regarding the going back or the reopening we're talking about. And this is a point for discussion. This is a point for concern. Are you saying we need to go back to school to reopen because you feel you can't stay at home again, because you feel you need to start earning your salary again, or are you saying we need to reopen the schools because you know that it is safe for us to reopen, and we have the facilities, we have the processes, we have the protocols in place to reopen? So there could be different motivations behind let us reopen our schools. But among these, I want to encourage us and the ministries and the agencies that among the motivations behind reopening the schools, safety should be a top priority, right? A well-planned protocol for disease prevention and control should also be considered. And we need to also have a well thought of guideline for people in schools, the school management entirely, to implement. And this can now inform us that, okay, we're ready, and then we can look at other things that can motivate our reopening. For many schools, I can confirm to you, we've spoken to quite some school owners, administrators, regarding their preparation to go back to school. One thing that is common to all of them is, yes, we want to go back to school, possibly because they are tired of staying at home, right? But how prepared are they? How do they see going back to school? It's quite challenging for us now. Quite challenging in the sense that many of them really don't see what we call the new school now. They still see the school as it was before COVID-19. And many of us here in this training today, many of us agree that the school is no longer the same. So we now have what we call the new school challenges, right? So we got a lot of yes, 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 yes. When we asked, do you think COVID-19 has created new challenges in our schools? You said yes, 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 which means we now have new challenges at schools. But the administrators are not seeing it in that direction, which is going to create a lot of problems for us when the schools finally reopen. And then we'll talk of risk multipliers. Of course, COVID-19 has a lot of risks in itself, but there could be certain things that we can focus on to look at what can happen when we finally reopen. And then this risk can be multiplied by certain failures, what I call failures in our systems, by the way generally we approach the reopening system. One of the multiplier factor is the perception of people towards the virus. Quite unfortunate. You might still come across some individuals up to now who don't believe COVID-19 is real. You might still come across some individuals now who think COVID-19 cases are politics. Just to share with us, I was exchanging a chat with someone on LinkedIn yesterday, and what was the engagement about? I saw a video from WHO advising the public how to properly wear their face masks. And this guy, I think from maybe from the United States, I can't really pick his country again. This guy started attacking the video, saying the video is trying to prevent people from having their freedom, trying to limit human freedom. Face mask is unhealthy. Face mask is going to make people to lose their freedom. And we're like, what's the basis for this guy's argument? His point is the use of face mask is purely political, and the world power wants people to lose their human freedom. And that's kind of strange to me as a professional. Like, I don't know someone can be talking like that. And one of the people on the thread actually asked if the guy was educated, and he said he has a degree in mathematics and one other course, one other profession. And you want to see how learned, you want to see how much information he should have, having a degree in mathematics, but yet look at his perception towards COVID-19. Now, how much more people in Africa, how much more people in Nigeria, a lot of people who don't have access to education, formal education. A lot of people don't have the level of awareness we have when we go online, when we go to Facebook, when we go to Twitter, when we go to LinkedIn and other platforms. Of course, when we go to all these places, we see what is happening all around the world, and it can help us modify our own individual perceptions. But what of that man, what of that woman, what of those people who really don't have those means of accessing information? How do they see virus? They really see virus the way we see virus. So if you get to the house now, tell your people who really don't have access to information and say, oh, this is what is happening. COVID-19 is not real. They just believe it's not real, right? Because they trust your information. And this is going to be a problem for us. If the school administrator himself or herself also doesn't believe that COVID-19 is real. If the school administrator also doesn't believe that COVID-19 can spread by maybe physical contact or by proximity or whatever it is, and then it's going to expose the students, it's going to expose the teacher, it's going to expose the whole system, and then by extension, the community transmission will increase. So that's a risk multiplier for us. The second one is prevalent mode of transmission and awareness. Of course, here in Nigeria, by now, I want to say we have a lot of information, maybe because we are privileged to use some of the social media and the likes, but there are people who still want to rely on us to hear from us what is happening out there. And when it comes to mode of transmission, when we really also don't understand the transmission process itself, how someone who is staying at home, not going anywhere, can get infected with COVID-19. We don't understand how that happens, right? We don't understand um, how someone will go out, get COVID-19, come back, and they will not show symptom, asymptomatic. These are the problems regarding community transmission. And the level of awareness is quite low when it comes to how this transmits, because the community, the society is divided. I have friends, when you tell them, especially when I go to church, I'm a Christian. When I go to church and I'm like, okay, I need to use my face mask, and some of my people in the church would like, oh, are you afraid of dying? Like, no, it's not about dying. It's about doing the right thing. It's about following precautionary measures. And someone will be telling you, don't worry, I don't have COVID-19. This, how am I sure you don't have COVID-19? Of course, I'm not putting on you that you have COVID-19, but as much as you want to stay safe, let me also stay safe. So wear yours, let me wear mine. It doesn't really cause any harm to me doing so. But in churches, in mosques, in markets, in schools, these are places where the spread, community spread, can really increase if the awareness is really not worked on. The market women really don't understand what you're talking about when you're saying physical distancing, because they need to sell their market, right? So these are problems. And in schools, let me emphasize on this. We will agree that school children want to play together. We will agree that school children want to share together. Let me bring my experience into this. When I was in primary school, the school I attended, we didn't have water facility in the school. Yes, so I came from that background. We didn't have water facility in the school. When you are going to school in the morning, you have to go with your water bottle, fill with your water, go to school with it, right? So during break time, during lunch time, what we do is, what we did then was, you have your friends, you finished playing football, you finished exhausting yourself, trying to just get active. And when you become thirsty, I'll drink from my water. My friend will also have to drink from my water, because we have to share. Not everybody will bring water to school. And that is the problem we'll be talking about when you're talking of community transmission, when you're talking of awareness, when you're talking of how prepared we are, right? We cannot deny children from playing. That is actually the fact. When they are coming to school, they come in groups, they come in clusters. And that is something that you cannot manage for them. But the level of awareness is quite important. Inadequate planning process. Um, like I said before, the federal government, we have a guideline now for safe opening of schools. They have said we're quite ready to go back to school. They have said the unity schools are all prepared. Now, in another news, I also saw that the Minister of Education, Malam Adamu, the Minister of Education, also was saying that more than 50% of the schools are not prepared. Now, talking about public schools, talking about private schools, more than 50% are not prepared to go back to school. Even the 50% that you think they are prepared, they really don't have a defined structure in place. And that's talking about weakness in our planning process. I would say if your planning is weak, if your planning is defective, the outcome may be disastrous. So we don't hope something like that can happen when we open our schools. But I can tell us as an expert that Nigeria, especially, we don't have a well-defined plan to reopen our schools. Lack of well-defined emergency management system. This is another problem that we might face as a risk multiplier. Before COVID-19, children can easily play in school. Someone can get exhausted, maybe collapse or whatever it is. There are children who may have underlying health problems. Now, because of COVID-19, this underlying health problem may become complications. So you may have more cases of faintings and collapsing in schools. You may have more cases of children pupils, students falling sick in schools. You may have these cases, but the question is, do we now have a procedures for managing these situations? Now that we said schools can reopen, if someone suddenly become ill in the class, do we have a procedure for managing such a person? Do we have a procedure for handling such a person? Should it be COVID-19? How then does the teacher have to manage it? How then do the fellow students in class, children, pupils, have to respond to that situation? Do we have this information? Do we have this awareness? Do we have a facility where we can take such a person to before confirming, oh, this person is suffering from malaria or from COVID-19? Right. So our emergency response is quite weak, not effective. And if we want to base our reopening of schools on that, the risk is going to multiply. Lack of resources and facilities. Just like I shared my experience, in my school, then we didn't have access to water. And because of COVID-19, we have seen how important water is in every organization. We have seen how important water will be to our schools when they reopen. Because if you want to follow the precautionary principles, if you want to follow the guidelines, every student will have to wash their hands periodically when entering school, while at school, when leaving school. You have to keep washing your hands. And I can tell you, many schools in Nigeria don't have access to water. And this is going to be a challenge. Apart from water, we're talking of human resources. Do we have trained professionals in those schools? Many schools don't have school clinics. Many schools don't have school nurses. Many schools don't have any professional apart from teachers. Many schools don't even have first aiders. And these are talking of resources. Talking of facilities, many schools don't have power, electricity. It is not there in many schools, right? So when you don't have power, you don't want to talk about online learning because you really need power for that. The gadgets are also not available for teachers and for students. So these are issues that when schools reopen, governments may be amazed at what the impact may be. We're not making negative predictions, but we're just working around information that are available for us now. But it's quite a reality for us that lack of resources and lack of facilities could be a risk multiplier. Where do they take their classes now is another question. How many of them who are in that class is another question. Is the class conducive? Is the class safe with or without COVID-19? These are questions that need to be answered when you're talking of reopening our schools. We might have been managing before COVID-19, but now with the effect of COVID-19, we have to look at situations in different angles, different ways, different perspectives, and really look at the reality that we're facing. Attitude to safety is quite something that we're missing in Nigeria. We really don't have a positive attitude to safety, and that is not a good news for us. And this has affected families, this has affected individuals, this has affected organizations, including religious organizations. We take things for granted when it comes to safety. And this will also be a key player by the time schools reopened. When they were writing the WAEC, that's West African Examination Council, when they were writing the exam a few weeks ago, I went to visit one of the government schools, one of the public schools, to see how the system is being managed. And I can tell you there was no difference between before COVID-19 and now that we have COVID-19. The students, the teachers, everybody just behaved as if it was a normal school. And that may be a problem for us when schools finally reopen. So I'll talk about, of course, I know we can have a lot of more challenges when you want to look at it, but I just have 10 of them listed here. I want to share with us as some of our concerns when schools are reopening. We have looked at the guidelines released by the federal government, the Ministry of Education, and then we have seen some of the recommendations in those that guideline. And the question now is, how do we handle this when school reopen? One of them is mandatory temperature checks. Apart from Nigeria, many schools globally, now, what they do is when their students are going back to school, they subject them to mandatory temperature checks, right? So they want to say, okay, your temperature is high, your temperature is this, you cannot enter the school, you have to go back, and stuff like that, right? So in Nigeria, let's look at what the case could be. The guideline says you have to do temperature checks for students, for children, before they enter school. Do we have the means to do these temperature checks? Who is providing the testing facilities? Maybe infrared thermometers, for instance. Who is providing this? It might be surprising to you if I say some schools cannot afford to buy that thermometer. It might be surprising to you, but that's the reality, right? Now, the second thing we want to consider is how long can we be committed to this testing or to this temperature check? Okay, let's say we just reopen school today. Yeah, school activities, come to school, we'll get you checked, we'll get you checked, we'll get you checked. The Nigerian system, I know, which may also be true in many parts of the world, is after a maximum of 1 month of that routine temperature check, the commitment will gradually drop. If it's actually up to 1 month, I'm saying 1 month to be optimistic. If it's actually up to 1 month, after first week, second week, that temperature check will drop. Now, does the government, does the Ministry of Education or responsible agencies, do they have a means to ensure that this testing process continues? Do they have a means to ensure that administrators in schools and learning centers are constantly checking the temperature of their guests, of their students, of their teachers before admitting them into schools? This is a problem and one of the challenges we're going to face when school finally reopens. Physical distancing for children and pupils. This is another thing that we really have to battle with. I call it a battle because it's really going to be a battle. When you have children who have been friends for, say, 1, 2, 3 years, and now they have been separated for 6, 4, 5 months, and then they are coming back to school, you are saying, no, don't touch, no, don't come close to each other. That may really not work. You see these children, out of excitement, they just want to hug themselves at first sight, right? You see them, they want to play together. They've really missed a lot of things together. And now that they have opportunity of coming to school, they want to play together. So that's a challenge we're going to have to solve. How this infection can be managed, even when children want to play together, even when pupils have to sit in the same class, even when they have to come to school every morning and leave school every evening, holding their hands along the way to their houses or to school. Outdoor classes. In some countries, one of the strategies they have implemented, especially with regards to physical distancing, is conducting their classes outside so that they can have more spaces and the likes. I can say this has really worked, and to some extent it has prevented or it has limited the spread of COVID-19. Now, but the truth is, if we bring that to Nigeria, if you bring that to some other parts of the world, can this be a challenge? Let's assume schools now reopen in Nigeria, schools now reopen in Ghana, for instance, and we say, okay, one of the methods we want to use, because we don't have enough facilities to accommodate everybody in the same class, is that we can take some classes outside. And while the classes are going on, it starts raining. So are you going to leave COVID-19 aside and quickly bring everybody into the same class, what you were trying to avoid? That's one question. Now, talking of outdoor classes, a lot of schools are also prone to flooding here in Nigeria and many parts of the world. Okay, you say you have canopies, you have built temporary structures so that even if it's raining, they can remain outside, remain physically distanced. That's fine. How about when flooding actually comes? So when you have flooding, Something is telling me you want to drop COVID-19 first and get people out of that flooded environment. So you have to pack them into the same room that you're trying to separate them from. This is a challenge that we have to look out for, because I can also confirm outdoor classes may be one of the solutions, one of the measures some schools will be considering even as they are planning to reopen. Embracing alternative learning methods. In Africa, in Nigeria, online learning is not a tradition, or I'll say was not a tradition before now. Many people, even those who have finished university education, really didn't believe in online learning. And this has remained a challenge. Even teachers in various learning centers, in various schools, really don't embrace online learning for whatever reasons. They have their reasons. But now the reality is the regular traditional classroom structure would not be enough. So we have to move along the global trend. We have to adopt new learning methods. Is the system prepared for that? The teacher who will be using that method to teach students, if he or she has to, does that teacher have confidence in that learning method? Because this is a factor you want to consider. Now I'm a teacher, for instance, and I really don't believe online learning can work. I really don't have trust or confidence in online learning, but I have to use it because my school is using online learning, right? So you see that this will affect the way I communicate with the students when we're engaging online. This will affect the way I pass my information, and this will affect their level of understanding. And I can easily attribute my failures to online learning because I can just tell them online learning really doesn't work. And that's the problem from the angles of teachers. How about parents? A lot of parents also don't have confidence in online learning before now. Now that the information is coming that we have to look at alternative learning methods, how prepared are the parents to embrace these online methods? This alternative, I'm using online as one of the cases, but there could be different methods which we might be exploring some of those alternatives later. But the thing is, are the parents prepared? Are the teachers prepared? How about the students? How about the pupils? Do they have the facilities for engaging in alternative learning methods? Okay, it's time for mathematics, and we cannot take it in classroom. You have to stay in your house. You have to stay in this particular location and take this mathematics class. Do you have the device? Do you have the internet access? Do you have power? And a lot of things we want to consider. So you see, when government is saying we have to look at other learning methods, this is going to be one of the challenges that the new school will face when they actually reopen. Regular hand wash after touching surfaces or another person. Like I said before, many schools may not have the hand washing facilities, which is going to make it a big challenge. And for children, for students, for pupils, it might also be difficult for them to keep to that routine, for them to keep to that tradition of, oh, I just touch this public surface and then I have to wash my hand. And you agree that there are a lot of public surfaces that people regularly touch in schools, even on their desks, even at the entrance to their classes. These are hot spots that people can easily get COVID-19 from. I am saying get COVID-19 from because, of course, we've been told by authorities that when you touch some of those surfaces, you can contract the disease. So based on that, I'm also saying that when you touch your doorknobs, your door frames, whatever it is, you can also get COVID-19. So how do we manage this for children? How do we manage for pupils and the likes in school? How about the teachers? How committed are they to observe this tradition of washing your hands after touching or after touching someone that is sick and so on and so forth? And you can see that this may increase the community transmission that we have, making the case to spike when we're expecting a downward trend. Mandatory wearing of face masks. Of course, I don't know of many places, but I've heard of cases in the United States where people protest or where people protested against wearing of face masks. I'll just share with us one of the guys on LinkedIn. who was also protesting on LinkedIn against wearing of face masks. Aside that, we have people who are not protesting for wearing a face mask, but they will not just wear it because they believe it's just a waste of time. For instance, someone who doesn't believe that COVID-19 is real will not have any reason to wear face mask, and that may be a challenge in schools. Someone who believes that COVID-19 data and statistics are purely political may also have a problem wearing face masks and following other precautionary methods. Someone who has other perceptions of COVID-19, this will affect how they embrace some of these measures. Wearing of mask has been one of the methods in industries, even before COVID-19, to prevent being infected, to prevent health injuries. So it makes perfect sense if you are advised to wear one so that you can reduce your chance of contracting COVID-19. But the issue is if the teacher, if the administrator, if the school owner also don't believe in wearing a face mask, then the students, the children, the pupils will not also do the same. And if anybody is infected among the students, you can be expecting that everybody in that class may get that infection. And that's really going to be a sad news. Isolation centers in schools. This is also another challenge that we have to face as the new schools resume, right? Normally, if you want to follow the procedures in COVID-19 now, if someone becomes sick, even before the person is confirmed, you have to isolate the person just to be sure whether it is COVID-19 or not, just to prevent, in case it is COVID-19, prevent further spreading it, you have to isolate the person. So what now happens when you have a student in the class who becomes sick? Do they have isolation centers in those schools? Who manages the isolation centers? Do they have healthcare professionals in all the schools? Now, in a class where a child becomes sick, what happens to the other students, other children in that class? Do you just pick the child and say, okay, you need to go to the hospital, or you pack the entire class and say, you guys must have contacted COVID-19 by chance, we need to isolate all of you? How will the parents react to that? These are issues that government and agencies need to consider when they are planning reopening of schools. Because if you want to follow the global trend, if a child becomes sick in a class, you need to isolate the entire class. How are we going to manage that when school reopens? That's a challenge. Training for teachers, administrators. This is also something that we want to look at as a challenge, because many school teachers, many administrators, many school owners, of course, they know how to teach. We commend them for that. But beyond teaching, the other training that they will require for them to make a safe school when they reopen, they don't have those trainings. At least by now, as a professional, I am expecting that every school should be making an attempt to train all their teachers on first aid and first aid procedures. That's going to be basic in times like this. Every school should be planning on how to get access to medical facilities if there is an emergency. And all schools should also have defined emergency procedures. These are the things that will go around training. And beyond that, we're talking of new learning methods, talking of especially digital learning, right? Many teachers have spent 10 years, 5 years in classroom doing the traditional classroom learning. You may be surprised some teachers in schools here in Nigeria, for instance, cannot operate computers. Some teachers in schools have smartphones, but they don't know how to use the smartphones. They only receive calls, which tells you that such a teacher is not prepared for digital learning. More training is required. We've seen administrators, school administrators, who also don't know how to operate computers, right? When I'm talking of operating computers, I'm talking of basic computer uses. Many of them cannot confidently type documents in Microsoft Word. which is amazing. I want to use that word, amazing. They are school owners, they are teachers. So are they prepared for alternative learning? Are they well trained? On the general scale, the answer is no. Then, are they making plans towards that training? We've spoken to some schools and there are no plans. There are no plans. So this is a challenge that we're going to face. You may have some schools, you may have some teachers building a kind of resistance towards new learning methods because they themselves they are not trained to adopt to use those methods because they themselves they are not well informed about those methods. So their basic line of defense is to build resistance and say, okay, this is not good for our school, this is not suitable for the students, this is whatever reasons they want to defend it. But that's a challenge, and that's something we need to look at as schools are reopening. Because whether we like it or not, whether we want it or not, alternative learning methods will come to stay. That is one thing that COVID-19 has brought to our system, and I am happy for that. It makes us to do things in a new way. Stay, of course, off the track on the traditional method and adopt new strategies, new approaches. The training is very important. Access to functional healthcare centers. I talked about this before. We want to expect that there could be one or two cases of emergencies in the schools when the schools reopen. The thing is, we don't know where those emergencies will come from. It might be 2, it might be 3 by 10 in the whole of Nigeria, maybe in the whole of Africa, for instance. But we don't know if it's going to come from Lagos. We don't know if it's going to come from Accra or from wherever we're expecting it. The thing now is every school must be prepared. Every school must build that system. Every school must ensure that they have access to healthcare centers in case there is an emergency, in case they need to use one. In reality, Nigeria, we have that missing. We don't have access to functional healthcare centers. Take away the factor of COVID-19 on a regular basis, on our day-to-day living in Nigeria. Many of us lack access to healthcare facilities. Is that the healthcare facilities are not well equipped, or we could not afford them, or for whatever reasons? Now in COVID-19, the case is totally different. We now have more pressures on those healthcare facilities now. We now have more people, more sick people in healthcare centers now, which means if a child becomes sick in school, for whatever reason, that child and the children in that class may be at risk. That's a challenge for us. We have some testing centers in Nigeria. I went through the website of the Nigerian Center for Disease Control, that's NCDC, and I saw that we have in total of 83 testing laboratories in Nigeria. Now, across the whole country, we have 86 testing facilities. 68 of them are government facilities. About 15 of them are private-owned facilities. 83 centers serve all the schools we have in Nigeria. This is a question that the government may need to answer regarding how prepared we are to reopen schools. The implication is this: you may now have a child, somebody's child, you may not have people's children who will stay in isolation center for weeks or for days without knowing what is wrong with them. Yeah, a child suddenly develops high temperature, suddenly develops fever. I'll say, oh, we don't want to know whether this is COVID-19. We don't know what this is. But because the testing center is not easily accessible, because we don't have many of them around us, you may need to keep that child for 2-3 days before releasing the child to the family. And you know what will happen to that family in those periods where their child or their children are not with them. The challenge that I think we have not solved, talking of reopening of schools. Administrators, teachers, students, parents, are they all prepared? I said before, we are all eager to go back to school. Probably we've stayed for long at home. Probably we're just tired of the whole thing. And whatever should happen, should happen. So we are tired of staying at home. in summary, I want to go back to school. But are we prepared for that? Um, from my perspective, I would say no, we're not prepared. We're not prepared. But that's a challenge because by the time an emergency now develops in school, you now want to see the relevance, the importance of preparation that we're talking about. You want to see the whole school running helter skelter. You want to see the school administrator running up and down without achieving anything. Yeah, this child has collapsed. Yeah, this child is running high fever. And at that point, it may now dawn on the administrator. Yeah, I don't believe in COVID-19, for instance, but this child that is running high fever, could it be COVID-19? Then you see the administrator staying away from the child at that moment because he or she doesn't actually know what the issue is. So we want to talk of the trauma, we want to talk of the increased risk, we want to talk of discrimination, we want to talk of a lot of things happening in schools because we're not prepared to manage those situations. So here I just, like I said, we could have as many challenges as, even as I'm talking now, many of us will have been thinking of one or two other challenges that were not covered here. It might really be time consuming to want to exhaust all the challenges, really. It might be time consuming. So if you have any challenge or if you have any concern, if you think of any challenge that you think the schools can also face, feel free to share with us and we'll also be learning, we'll be happy to learn from you. But for now, we're going to focus on this 10 and then continue our class. So we have some suggestions, some recommendations on managing these challenges. Unfortunately, we did not look at them on a case-by-case study because of certain reasons. Number one, we want to also save time. I want to make sure that we get over this class as soon as possible. The first we can see is a child being checked with the infrared thermometer. We can see how distant they are. This is the person, look at the next person, look at the next person, look at the next person. Really, they are following protocols. But I can tell you, if my prediction is right, these 4 students were coming together holding their hands before they get to this testing point. And that's the common experience you're going to see when schools finally reopened. So federal government guidelines, the newly released guideline is targeted at 3 groups of people. The first one is those who have responsibilities to ensure quality education in our learning facilities. Just like us, just like you, just like parents, just like everybody, we want quality education in our learning facilities. And that guideline is good for us to look at. Boards of school management, administrators, and teachers, they also need to look at the guidelines. School communities, including learners and parents, they also need to look at those guidelines, right? So that's from the Federal Ministry of Education in Nigeria. So we have some 8 key recommendations that we believe should be considered when we're talking of school reopening. One of them is to update the learning curriculum. So that's number 1, updated and concise learning curriculum. This is in line with the Sustainable Development Goal number 4, focusing on quality education for everyone. Before COVID-19, we might have had different courses, different content in our programs, but at the onset of COVID-19, it's an opportunity for us to do a review, to audit our course curriculum, so that we can compact them and make them more concise and more quality for the students. And that will lead to achieving Sustainable Development Goal number 4. Number 2 is an instructive guideline for school administrators. I will say instructive because in real sense, many school administrators are seeing the government guideline as kind of suggestions. They are seeing the government guidelines as kind of opinion, right? So they are not seeing any mandatory obligations towards those guidelines. And that's quite unfortunate, and it may affect the outcome of whatever we have in schools when schools finally reopen. Number 3, access to clean water and sanitation, in line with Sustainable Development Goal number 6. This is very important. Clean water and sanitation facilities cannot be omitted in our schools now. If the old schools could survive without clean water and sanitation, The new school we have now cannot. They cannot. So it's really good if government can take some of these measures, look at how prepared the schools are for reopening. Community-based infection prevention, control, and emergency system. This is quite also important, because here in Nigeria, we really believe, or we really focus our attention on this central emergency management process or system. So if something happens, for instance, we have to call the fire service, and the fire service will start coming while we are doing whatever we are doing. But at the onset of COVID-19, we have seen a change in this approach everywhere in the world, including Nigeria. And that's where you can now see that we are now localizing how we approach COVID-19 cases. That's why you are now seeing that we're having testing centers in as many places as possible. That's why you're now seeing that we're having isolation centers in as many places as possible. This is kind of building a community-based disease prevention and control system. And that can also be increased to our schools. The schools can be trained, the schools can be empowered, the schools can be assisted on how they can manage some of these infections or suspected COVID-19 infections in their schools. This will go a long way in reducing the number of infections and controlling that spread even before NCDC comes, if they have to come. Introduction of safety clubs in schools. Yeah, at a point like this, safety has become a top priority in everything we do, and thanks to COVID-19. Because before COVID-19, many people don't believe in safety. When you're talking of safety, it's kind of, you're talking of something in the books. But now we have seen the reality of why safety is very important. In schools, if we have safety clubs, which is fully supported by the school management, it's going to create a very good awareness base for that school and for the community. And by extension, every student can take that information and that awareness back to their families. I've heard of someone who was sharing with us. He works in one of the oil companies here in Nigeria, and he was sharing that sometimes when he started working with the company, he got a lot of trainings, and then his perception of safety changed. And because of that, he took it back to the house and he started training his children on how to observe safety precautions. He got to a particular day. He said he had even forgotten, he was just doing something, and one of his children, a boy, just called him, "Daddy, that's not safe. You have to hold the handrail." That a little boy now addressing him, reminding him of what to do. Now, if you want to take this trend back to our schools, imagine that every child in our schools have this type of training. They can easily go back to their parents, even if the parents are not educated. These guys, these children can help us to pass safety information to them. And you can understand how the learning process can go between parents and their children. So safety clubs is something that we need to look at. Improved welfare in learning centers. Talking of adequate spacing, we'll talk about that. Well-ventilated classrooms, power supply, feeding support. There are children who go to school without eating, not because they don't want to eat, not because they are not hungry, but really because there are no food in their family. And when a child has not eaten, that will increase stress physically, psychologically. And when you are under stress, it might also increase your chance of contracting COVID-19 because your immune system will be weak, right? So some of these things are important for governments and regulators to look at, assessing the need for reopening and assessing how prepared we are to reopen. Access to medical care and emergency service, I talked about this. We need to consider this as a key recommendation in times like this. Improve synergy between education ministries and stakeholders. If there is a better time to do more together, to partner together, to collaborate together, as government and school owners, as government and parents, as teachers and parents, as students and teachers, whatever we are, stakeholders, this is the best time to do that now. Because that synergy will help us in preventing the diseases and in managing the outbreak if there is an infection. So generally, we can look at some of these as additional recommendations. Agencies to audit learning facilities before reopening and making recommendations. right? So before government can really say this school is ready to open, there must be a school specific audit, not a general overview that the way the government is doing now. They just say, okay, most of the schools are prepared to open, many of the schools are not prepared to open. Right. What I really expect is government can send their delegates to assess a particular school and say, okay, this school you cannot reopen because your facility is not good enough. And those are the kind of situations we expect that can make our system to be better in real sense. Like we saw the children who were taking their exams in that building, there are even worse cases than that in Nigeria and many parts of the world, especially in Africa, which means before COVID-19, there were students, there were children who were attending classes in an unsafe environment. Now, with the impact of COVID-19, the situation is even worse for them. So government should do a lot in doing their due diligence. Ensure basic needs for safe school operations, adequate spacing in classrooms, face masks, clean water, cross ventilations. Yeah. So systematically make digital learning a major requirement for schools. I want to also believe that if government is proactive enough, if they would approve any new school now, if anybody wants to register a school now, digital learning should be a major requirement for approving that registration. And for those who are already registered, there should be a systematic process to make sure that digital learning becomes part of their system. This is good, and this will help us to ensure sustainable education. We also need to look at training of teachers and educators, train them on safety, train them on first aid, train them on how to use additional learning methods, including using online, using webinars, using virtual classrooms like this platform, using televisions, radios, and every other means that are possible and practicable, right? But the training for teachers is quite very important. Increase awareness to learners, parents, and other stakeholders. While you have trained the teachers, you also need to let the students, the learners, know of the new changes, and help them to adopt that change so that the benefits can be derived. Parents also need to know, and every stakeholders also need to know the changes in the system. Develop a local coordination team to work with the Presidential Task Force on COVID-19. Of course, we know that government at all levels have Presidential Task Force, and what they need to do is, of course, they have been doing this, working with state ministries of education, working with local governments and the like. Even in schools, there could also be a group of schools, it could be a group of teachers well trained on how to manage COVID-19 cases, on how to identify some of those suspected cases, right? These guys who have been trained can now give feedback to the management, which in turn can give feedback to the medical facilities or to responsible agencies, as the case may be. But we cannot overemphasize the need for local coordination when it comes to synergy and preventing COVID-19. So at this point, like I said before, I've really taken some time, and I want to also assure us that if I want to continue, it will not end. There are a lot of concerns, there are a lot of questions, there are a lot of recommendations. People have things going on their mind regarding reopening of schools. Some parents say we cannot allow our children to go. Some parents say we cannot allow. So different things going in different minds. So if you have anything in your mind as well, please feel free to share with us. You can type in the chat area, share some of your recommendations with us, share some of your concerns, share your questions with us. I will be so happy to learn from you as well. We'll be so happy to share your views. We'll be so happy to improve together and then to make a better and safer system for our schools. So here's my contact. If you want to send me an email, you can send an email to me at yinkafashusi@maranaglobal.com. That's my official email, and you can contact me on this phone number as well. So at this point, I would say thank you for listening to us. Thank you for the time you've taken to hear me speak. Thank you. I'm really happy that we spend this time together. So if you have your questions, please feel free to type your questions. Richard here will take the questions after our second presentation. Then we can answer the questions together.
That's a brilliant presentation, Fashusi. Thank you very much. Very insightful topics that you have just presented. Would you like to answer some questions right now, because there are many questions and there are many comments?
Sure, sure.
So
I can take some of the questions.
Yeah, let's start with this one from Safety Net Network. They are asking if the government cannot intervene with acts or something with the schools that fail to comply with COVID-19 protocols. So when the schools resume, is possible? Do you think it's possible to the government intervene?
Yeah, so I'm trying to get that question. That's Societal Safety Network. So can the government read riot acts against?
If you click on questions on the left side, you're gonna see.
Yes, yes, I have it now.
Great.
So can government read riot acts against schools administrators that fail to comply with COVID-19 protocols when school resumes? Yes, governments, I can tell you, governments have access to whatever legal framework they want to use, including the Riot Act. Governments have the best, I want to believe they have the best legal advisors as well. So they have all these means to do whatever they need to do. But the will to do is something that we need to consider. That's one thing. That's number one. Then apart from the will to do, you also want to look at the environment in general. If government should take such an approach, knowing how unprepared we are on a larger scale, it may lead to over 50% of the schools going into trouble. Right, that would be a chaos in the educational system, using Nigeria as a case study. Because from all the information available to us, the system is really not prepared, ready for reopening because of facilities, because of one challenge or the other that we've looked at. So even if government has some of this, it might be difficult for them to implement. That is the reality. Otherwise, it's going to create a kind of a chaos in the educational system. Thank you, Societal Safety Network.
Great. The second question that we have here from APA, he's asking if you think that every school, both and public, should have something like a sick bay, which could be a means where pupils or students can be attended by the school health personnel.
Yes, and by global education standard, and even beyond the education sector in the industry, the answer is yes. All schools need to have sick bay. That gives them a better chance of managing situations like this and forestalling emergencies, right? So they need sick bays. But of course, if you want to look at realities, we know that they cannot afford sick bays, especially at times like this. They didn't have before. So coming back to school now, reopening, they may not have that. So what I think they should do is they can, of course, partner with healthcare facilities in their localities. And that is what organizations do. Even at Marana Global, that's what we did. We didn't have our own hospitals, but what we did was we have a kind of an agreement with a medical facility. Okay, if our staff suddenly becomes sick or we have an emergency, we'll bring them over to you. And that has kept us going over some time. So schools can look at that as an alternative to having their own sick base. If they cannot afford one, they can, of course, assess any good facility, medical facility around them and say, okay, this is our school introduced. They know how to follow their formal procedures. But if they can, the best thing is they should have their sick base. All schools should have their sick base. Even have trained first aiders. Thank you for that.
Thank you. Another question that we have here is if the schools or the institutions are enough qualified, if they have enough qualified people, personnel to handle emergencies in case it happens.
Okay, to that question, my very quick answer will be no. Of course, I'm saying no. I'm looking at Nigeria and Africa as my reference. I'll say no because, like I mentioned when I was talking, we have a lot of teachers who are well educated. They are trained teachers, but there's a difference between being trained as a teacher and being trained as a first aider, and there's a difference between being trained as a teacher and being trained as a safety officer. So many teachers really don't have that skill to manage emergency situations, and that's the situation we have in Nigeria. So we don't have that competence among our teachers.
Okay, sounds good. We had a lot of comments here, and I think you can, yeah, after the conference, take your time to read because they are very, very insightful. A lot of people have been commenting and just agreeing with some points and just questioning a lot of stuff. And I think we could, generate a lot of discussions around it. But maybe we should start and move forward to the next presentation.
Okay, so if Tokwe is around, you can just bring him up. Let's enjoy his session as well.
Perfect. We have a last question here.
Okay.
What could be the challenge between schools adopt the new methods of teaching students? It's the last one you can read on the chat. But pretty much, what, in your opinion, what should be the challenge between schools adopt the new methods of teaching students?
Um, I think I already mentioned some of these challenges when I was talking. One of the key challenges is that even the teachers are not trained on the use of these new learning methods, and that's a critical one. Apart from that, training is one. Another thing I want to look at is the facility for these learning methods. Do they have the devices? That's one. Do they have stable networks in their school? They have to engage in digital learning, for instance. That's another thing. Then do they have power in their school? A lot of things have changed, but in my primary school days, we didn't have light in our school. Talking of electricity, we didn't have in our school. And I can remember the only time we put on generator for students and stuff like that was when we wanted to do a computer class then. That was in my junior secondary school level 3. Right. So after that, throughout my secondary school, I can count how many days I saw power or electricity in the school. And that situation is still the reality in many of our schools still today. So a lot of challenges we want to think about: power, training, awareness, perception of these learning methods are quite important.
Perfect.